Hello everybody, I'm so excited today to be able to connect with you, my fellow Pilates instructors. Today's topic is client's pain, what questions to ask. Okay? This is particularly important when you are seeing this client for the first time. Yeah? Understanding the pain, knowing the pain will help you program better, especially during the first session when you're getting to know them and they're getting to know you, and that your client is choosing between trusting you and not trusting you, coming back to you or not. Okay, let's get started. And I'm going to be moving my eyes back and forth between you and my document because I have a few questions written down. I just want to make sure I don't miss any of them, okay? So the first question to ask is, where is the pain? And oftentimes people do not know exactly where it is, or they know exactly where it is, but they cannot articulate it, and especially this one. For example, the client said, I have low back pain. Okay? But when you ask them, can you show me exactly where it is? They will tell you, it's right here. Oops. It's right there, right? So this is not low back. This is where sacrum SI joints are, right? But to them, it's somewhere around there. It is in the low back, right? But then we know programming for low back issues and sacroiliac issues, they're similar, but they're different. Okay, so knowing exactly where it is can help you to start to have an idea where to begin and how to begin. Okay, all right. The second one is, what time of the day you have most pain? Okay, this question can help you figure out if too much activities cause pain or too little. If they tell you, for example, I have more pain waking up in the morning, but as the day goes by, it eases off, right? So which means movement makes the pain go away. And then you can kind of have an idea of what to do in your session. If you move your clients gently and correctly in the session, you know you have a higher chance to make the client feel better because of the movement, because their body needs to move. Okay? All right, so the third question to ask is, what daily activities trigger the pain? Okay? They can say to you, I can't bend down because bending down, trying to pick up my kids or trying to pick up something on the floor hurts my back. Okay, so then you know, okay, this client cannot or may not be able to flex their spine. Right? So cross any spine flexions exercises out, at least in that session, until you have a better idea of what's going on with the spine. Right? And they can also say something like, oh, I can't lift my arm and try to reach for something in my cabinet. So any of the overhead movement is out, right? At least for that session that day, you will not do those exercises or those movements with your client, okay? And the next question to ask is, what movement makes the pain go away? So it's the exact opposite of the previous question, right? So asking this question is super important because it will help you determine what to do in that session, right? If the client say, oh, when I lie down on my back, I like to bring my knees to my chest because it feels better. Oh, I just like to lie on my side because that position makes my back feels better, right? Or sometimes they will say, I like to kind of put my back into a bit more like an arch position, like an extension, yeah? That makes the pain go away. So then you know, okay, so in that session, in this session, I can do posterior tilt, exercises in posterior tilt. I can do exercises in side lying. I can do when I do pelvic tilt, or when I do hip fold, toe tap, the one that you do in on your back, the supine. Some people call it hip fold, some people call it toe tap or marching. I may use a posterior tilt instead of neutral, or neutral instead of posterior tilt with this client, depending on the movement they're comfortable in. Okay. So then the next one to ask, actually is the last question for today's discussion, is have you seen any therapist? What was the treatment? What had worked and what had not worked? Okay. This is to help you, for example, if the client has been seeing or was seeing a physiotherapist and was given exercises to do. Yeah. This question can help you decide whether or not those exercises have worked. If it was successful, continue to use these exercises in your client's program. Okay? Make them better by watching their form, correcting how they are doing these exercises to make them more effective. If they're given exercises that had triggered pain, yeah, from the other person, write that down as well, telling yourself, okay, so these are the exercises may cause more trouble, right? Sometimes it's not even the exercise itself. Sometimes it's because they have not been doing it properly. Okay, but in that first session, try to not go through these exercises. Try not to do them. Okay, and if your client tells you that they have not been seeing anybody, they did not see anyone, you ask them, are you self-treating? If you're self-treating, what did you do that had worked, and what did you do that make this condition worse? These questions can help you decide on the spot what to do and what not to do in that first session, because the first session is about building trust. It's about understanding people. It's very difficult, and it's not difficult, but it's very challenging. I oftentimes I get quite nervous in my first contact with my client until today, after a couple of decades of teaching, because it's just, we'll talk about this in another day, in another video. But anyway, so these are the questions you ask. If there's any other questions that you tend to ask in your first session with clients, please write them down. I would like to know, and then we can learn from each other. Okay? All right, until then, see you next time.